You're listening to the Dental Zone podcast. I'm Dr. Rachel Hall. This is the place that supports you to understand your dental issues, the causes and how to prevent them, empowering each individual to get the most out of life while bearing a stunning smile. Hello and welcome to the Dental Zone podcast. I'm Dr. Rachel Hall, holistic dentist from Brisbane, Australia, and I'm talking to you about how to improve your overall health by improving your oral health and taking care of matters that are going on inside your mouth. If you want to know more, you can hop on over to holisticdentistry.au, but for now, we're going to get into the zone. I want to talk to you today about the importance of working in partnership with your dentist or your dental hygienist to enable you to have really healthy teeth and gums and a mouth that is free of infection, inflammation, and toxins, and to address functional loading and stressors such as clenching and grinding, uneven bite, mouth breathing, and so forth. But you can be doing all the right things at home or seemingly doing the right things at home, like being told you need to brush twice a day for 2 minutes and that you need to floss and use mouth rinse. But you could be doing that and yet still have a problem. You could be doing that but not be doing it effectively. You could have areas of disease that you're actually unaware of, because the problem with things like tooth decay and gum disease in particular is that until they are quite advanced and far progressed, you don't often get any really obvious symptoms such as pain and infection. And this is the problem when I say to patients, hey, this is what's going on, blah, blah, blah. Oh, but I'm not in any pain. Well, pain's not a good indicator of whether you have disease or not. There are lots of things that we can observe and diagnose and detect before you're in pain. So with gum health, for example, there can be things like changes in colour, shape and texture of the gums, the height of the gums, how tight they are around the teeth, signs of tartar and plaque buildup. And you don't know any of these things are going on because you're not taught to look for them, and it's very hard to look for them inside your own mouth. But there's a dead giveaway warning sign that you've got a problem with your gums, and that's bleeding. If your gums bleed when you brush or floss, even if it's just a small amount of blood, that is telling you that there is inflammation and infection caused by bacteria. And if you were washing your hands, for example, and your fingernails dripped, blood dripped out from underneath your fingernails every time you did that, surely you'd want to know how to make it stop. So why is it that we accept that, oh, it's just my gums bleeding, it's no big deal, that happens all the time? Just because it's common doesn't mean it's normal, doesn't mean that it's okay and that things are healthy. So let's have a look at how you can work together with your dental hygienist or your dentist to make sure that you've got really great oral health and you can have really great overall health. Well, my focus is prevention, and I've done a series of podcasts, if you go back and listen to the more recent ones, about how to improve your overall health and your oral health. So we've looked at things like tooth decay, gum disease, oral hygiene care, examining your mouth, knowing what to look for, what the tools are that you can be using to have really great oral health. So if you work alongside your dentist and your hygienist, this person's going to be playing a really critical role in your preventive care and educating you in how to best care for your teeth, mouth and gums. You're going to find that if you take advantage of their knowledge and experience, you're going to get those pointers, those hints and tips that are going to take your oral hygiene from okay to absolutely excellent and in tip-top condition. So you want to establish a relationship with your dentist and your hygienist and make sure you have a successful hygiene program. You've got to feel like you've got each other's backs, that you're working together, that you're collaborating, that the hygienist or the dentist is doing their part, but you're also doing yours. It's a little bit like if you're trying to lose weight or get fit and you see a personal trainer and they help you, they do their thing with you, and then you just go home and you don't take on board any of their advice, you don't do any of the exercise that they prescribe, and then you wonder why you're not seeing any results. So you've got to work together. You know, your hygienist and your dentist, they've undergone years and years of highly specialised training to provide you with the care, the information, and the healing service that we provide. My dental practice in Brisbane, Australia is called Evolve Dental Healing. That's what we're about. We're about healing and health and well-being. Now, your hygienist isn't a dentist, but you could call them a preventive dental specialist. They're qualified to provide hygiene therapy, and they're a great source of knowledge, and they'll be your guide and your support person. Or if you have a dentist like me who is passionate about gum health and making sure your mouth is disease-free, then I'm going to offer you the same sort of thing. Our primary role is to help you save your teeth. And it doesn't take a rocket scientist to figure out that no matter how good your dentist is, I can't repair your teeth if you don't have them. We can't fix what isn't there. And so you've got to make sure that you're working together with the dentist, with the hygienist to remove tartar build-up, to get plaque under control, and really help you to deal with what's going on. Now, I get a bit pissed off with the fact that dentistry has diminished a treatment for disease and disease prevention to the term of a cleaning. We're going to clean your teeth. Well, F me. What does that say to you? Oh, I can clean my teeth at home. I don't need to know how to clean my teeth. I can clean my teeth by myself. Well, it's like saying I can cut my hair. Yes, I can, but I'm going to do a pretty bad job of it. And there's going to be bits that I miss because I can't see them. We are doing a treatment for gum disease. One of the things we do for that is we clean the bacteria and the bacterial build-up off your teeth from around your gums and under your gums. But we're not just cleaning your teeth, we're treating disease, we're doing hygiene care. So during these appointments, when you're coming for your hygiene care, for your regular checkup and teeth clean, and I say that a little bit because I don't like that term, we call it your hygiene appointment. What we do is we're going to evaluate your teeth. We're going to examine you for any signs and symptoms of disease, such as abscesses, cysts, signs of cancer, autoimmune conditions in the mouth. And we're going to look for diseases of your gums and teeth. And we'll do that at your recall appointment, at your checkup, and then we confirm our findings with things like x-rays and photographs. We'll do measuring and charting of the gum pockets. So we're assessing the health of your gums. We're going to check any teeth for mobility. We'll take x-rays when necessary. We're going to update your health history because, it's important to know what's going on with your health because certain health conditions and certain medications will affect the condition of your soft tissues and your teeth and gums. And then we'll do an assessment of your overall dental health. Then as part of your appointment, we're about education. So we're going to give you information on areas of prevention. We're going to guide you during the healing period from any gum disease. We're going to customize your oral hygiene program to suit your individual needs. And we'll tell you about the type of tools that you need, how and when to use them. Now, we're also, in my practice, because we're holistic, we're very interested in the nutritional aspect and lifestyle aspects of dental disease prevention. So we'll often provide nutritional counselling, we'll talk about lifestyle habits, we'll talk about supplements that you can take to support yourself and your gums, and it's really worth investing the time in getting to know about that, because gum disease and dental disease are multifactorial. They're not just about brushing and flossing and don't eat sugar. Then we're going to do hygiene therapy. This is where we get down to the business. Now we're going to remove plaque and tartar. We're going to do debridement, which is a name for the removal of any infected gum tissue. And we're going to make sure that we tidy everything up and we get rid of disease. Now we can do also other preventive measures in those appointments, like sealing the deep grooves, pits and fissures in your teeth to help reduce the risk for tooth decay. Some dentists and hygienists are going to do fluoride treatments. Now I'm not in favour of that, so we don't use fluoride. We use remineralising calcium products and hydroxyapatite. We can do desensitization procedures before we do the hygiene care, and we'll clean and polish the teeth. We'll take care of any rough edges on fillings and tidy those up so that they don't attract plaque and tartar. If your health of your mouth is quite poor and you've got periodontal disease, we'll do expanded periodontal therapy, or what is known as deep cleaning, and that will sometimes require the help of a periodontist, which is a specialist in gum care, and we can help you deal with your disease. But once it gets to a certain point of severity, we're going to need specialist intervention. And then we're going to monitor your recall program and make sure we see you at the right interval. Now, we're all kind of conditioned into everyone should go to the dentist every 6 months. And that's true for some people. But for others, they need to come more frequently, so every 3 to 4 months. And others less frequently, so once a year, for someone who's got really, really healthy mouth, teeth and gums and a low incidence and prevalence of disease or disease history. I've got some patients I see every 8 weeks so that we can really help them have a healthy mouth and keep their teeth, protect their heart health and protect them from related diseases and illnesses that are linked to gum disease, things like strokes, dementia, Alzheimer's, pneumonia, types of cancer. These are all linked to diseases in your mouth. So your hygiene program is always going to be designed with a holistic approach to your oral health and to your overall health. This means we're going to treat you like a real living person. We're going to tailor-make your hygiene program for you and not just based on you being another body in the chair with teeth. So if you're under the impression that your checkup is all that we do, or all your dentist or your hygienist does is clean and polish teeth, then I want you to understand that we have a much broader scope. You know, we do cleaning and polishing as the last thing. We do all your oral health checks first. We do all the measurements first. We treat disease first. And cleaning and polishing is a little bit of a maintenance thing. It's not something that treats disease. So what's your role? What's your relationship in the dentist, hygienist, patient triangle? You're going to make it possible or impossible for us to do our job, for us to achieve the results that we want to achieve for you and with you if you don't perform your role. It's just like I said previously, if you don't follow the instructions, then nothing's going to change. So there's a vast difference between the oral health of our patients who get involved with what's going on in there and those and don't. So we deal with thousands of different mouths during our careers, as well as all the different personalities and attitudes that go with them. And as it's different for all patients, we're going to have things in common. Patients are never going to be as well informed as we are, or as you are, because you've been listening to these podcasts and you're engaged and interested in what's going on in their mouth. Most patients are not going to be nearly as motivated as you will be, and they don't fully appreciate and understand how to utilize the help and support of the dentist or the hygienist, not in the way that you will. The fact is that you're going to be so well informed and motivated and appreciated means that this is a really synergistic relationship, so that hygiene therapy is going to take up most of the time of our appointment, but we're going to make sure we always give you the best preventive information that we can. But this is a difficult task if you lack the basic understanding of prevention and you're not self-motivated. The bottom line is that the success of your oral hygiene and dental program depends on you, on your want, your desire, your understanding, your commitment, your attitude, your mindset, and your willingness to work with us. If results are what you're looking for, then you've got to do your part and let us do ours. And then you'll get those results. You've got to take responsibility here because you're the one who's living in your body 24/7. You're the one caring for it. You're the one feeding it. You're the one doing all the things that you should or shouldn't be doing. So you've got to remember, you've got to take responsibility. You can't constantly blame the hygienist or the dentist for what you don't do. Think about it. You are the one who's the common denominator here. We're treating you, so it's important that you defer to the program that we recommend. Even if it varies from some of the things that I'm suggesting here in these podcasts, you've got to give your healthcare professional the chance to do things the way they think is best for you. And so I'm going to encourage you to ask questions of your dentist and your dental hygienist. It's super important. It's our ability to answer your questions, but we can't answer what you don't ask. If you don't understand something, ask us for clarity. Don't just sit there nodding your head to indicate agreement when you haven't really understood a word that we've said to you. I'm a patient. Before I was a dentist, I was ignorant about what was needed. You just know you've got to brush and floss, and I would never have asked these questions. It's very tempting to act like you understand because sometimes you're just a bit embarrassed to ask them to explain. But most people actually don't understand anything about what's going on in the mouth. They don't understand what causes tooth decay. They don't understand what causes disease. And then they don't really understand what to do about it. And you know what? When you ask questions, guess what happens to us? We get excited because, well, hey, I've got somebody here who actually cares enough to learn, who actually wants to do something better for themselves. And we love it. So please let go of your ego. Just drop it for a moment and ask for help. Don't forget to, if you want to, you can bring your phone, make some notes on there or jot things down before your appointment, and then you won't forget to ask us what you want. So what are the secrets of building a good relationship with your dentist or your hygienist? Get to know each other. Take a few moments to find out about each other. My job when I first meet you and ongoingly is to find out who you are, what things you like to do, talk about your family, your likes and your dislikes, talk about your life. But get to know us a little bit too. We are actually human. We have families, we have relationships, we have hobbies, we have things that make us tick. And it's much nicer if we kind of get to know each other and it's like friends looking out for each other. I'd also say, treat us like you'd like to be treated. Be friendly and your good feelings going to be returned in kind. The level of kindness you attract is the level of kindness that you put out. If you enter the office and, the first thing you've got is like, I hear this so often, I hate dentists. I hate being here. I hate you. I hate this. What do you think that does to us all day long, hearing that? I'm not saying it's personal, and I understand where you're coming from, but if you met somebody for the first time and the first thing you said to them is, I hate this. I wish I didn't have to see you today. Where do you think you're going to get off? You're not actually going to get on. Let's not be adversarial. Let's not antagonize each other before we even get started. We appreciate that you show up on time and that you're taking care of your teeth and mouth. We endeavour to run to time and see you on time as well. Tell us what your goals are. Tell them that you want to have the healthiest mouth possible and that you want to help. Be sincere, because then we'll know exactly how much you care at the end of the appointment. If you tell someone, that you want to do something and then you don't put in the effort, then your communication's off. Communicate any fears or anxieties or difficulties that you've had with previous dental visits or hygiene visits and with your home care program. If it's the same person that you've been seeing and you've never confided in them before, now's the time to do it. Start over, set a new relationship. Make a real commitment to follow the hygiene program that we customise for you. This is important because if you think that just turning up, listening to it, reading about it, listening to a few podcasts, going to the dentist and, randomly and periodically getting your teeth cleaned, you're freeing yourself from all responsibility, then you've got to think again. You're the one who's got to do the homework. If you've never brushed or flossed, would you need a professional cleaning every few days to keep your teeth out of serious trouble? Well, the answer is yes. But we're only going to be able to do what we can do in our visits, and we can only care about your mouth as much as you care about it yourself. Tell us you care. Show us with your actions that you're committed. I find it super exciting and really rewarding when somebody comes in and the first time I've met them, things are a bit of a mess. They're not really very motivated. They haven't really been taking great care of their teeth and gums. There's a lot going on. We work together to address those issues. And then we do a follow-up or recare appointment. And we see them maybe 6 weeks after all the hygiene care has been completed. And you can see the changes that they've made. Their brushing and flossing's improved, their tartar and plaque control has improved, their gum health has improved, and things are looking so much better. I love seeing that turnaround, and it makes the patient excited when we can say, hey, your gums are looking great, there's less redness, there's less bleeding, things are looking healthier, and they'll tell me that they've noticed changes. And then we'll do the gum measurements, and the gum measurements confirm what we're seeing. And then this motivates the patient to do what they're doing, to carry on, and it excites us because we know we've made a big difference to that person's life. And that's why we care, that we believe that we're making a difference. We're as much of a health professional as your doctor is, and you may have not been conditioned to look at us this way, but our role is different from that of a medical doctor. It's actually no different, because If the medical doctor said to you, hey, if we do this, I can save you from losing your liver or needing a heart transplant, wouldn't you do what they said to do? Well, we can help you to save your teeth. We can help you to have good gum health. And we believe a person who keeps all their teeth in a lifelong state of health can live 5 to 10 years longer than a person who lives a lifetime with dental disease and eventually loses their teeth. And not only do they live longer, they live a healthier and better quality of life. So no matter how hard you try, we shouldn't just be repairing issues. We shouldn't just be fixing problems. We should be helping you maintain the health of your mouth and prevent you from having problems. And that's a really big part of our role. Now, we've just talked about setting up relationship. Well, we've all got different personalities. No one's perfect. I'm not perfect, and I would say that neither are you. Neither would be your dentist or your hygienist. Problems do arise. We're going to have differences of opinions. If you sense a problem, don't wait to get worse, communicate. Maybe it's let me just take a breath. Maybe it's a temporary problem. You could have been having a bad day, the hygienist could have been having a bad day, the patient before you could have been really difficult, could have been a bit of a jerk, and the hygienist or the dentist hasn't quite settled yet from that appointment. Just, we're human too. If there's tension, then let's just get it out in the open. Try and get along with each other. Let's have a relationship. Let's ask things like, hey, how are you? Or say hello. How's your day? Those sort of things. That really supports us as well as supporting you. Let's work together. And then if we feel that things aren't working well, we aren't seeing the changes that we need in your mouth, then let's not get defensive. Let's work together. And look, if you genuinely are not getting on with your dentist and you genuinely don't like the hygienist, then look for another office. If you don't think you're getting the care that you deserve, then look elsewhere. Well, let's get down to business. We have to look at looking after your oral health. We have to chart a course to get you from where you are to port of disease-free. At the first appointment, this is really important. It sets the tone for those to come. We'll discover what you know about dental disease and what you know about prevention. The more you know, the less I have to go over things. Don't want to teach you to suck eggs. Don't want to insult your intelligence. And we have what we term dental IQ. And that doesn't mean we're calling people idiots or whatever, but some people have a very high dental IQ. They understand a lot about what's going on in their teeth and mouth, what causes their problems, and they're really proactive in their healthcare. Others have a very low dental IQ, and they really don't understand why their gums bleed, why they get tooth decay. They have no idea, and we need to educate them about that. They don't understand any links between gum disease and their overall health and their lifestyle and their gum disease, etc. So, it's really important that we know where we're starting from and how to pitch everything. We'll check your health history. We'll examine the condition of your gums and your soft tissues. We'll record any obvious decay. We'll record any infection. So we'll do this by charting your periodontal pockets, taking the measurements around the gums, looking for bleeding and infection. And I'm going to go into a little bit more about this because most patients have either never had it done, and that is a disgrace and a travesty, not by the patient, but by the dental profession, because this is such an important diagnostic tool. It's such an important way to pick up on disease that we can't detect just by looking. And it's a travesty if it's never been done, or it's been done but they don't really understand what the numbers mean. They don't really understand why they're having the pocket charting done and what that means. So charting pockets is the dental term for a procedure used to measure the depth of the gap between the gum and the tooth, called the gum pocket. It's a standard procedure that is accepted and used by all dentists and hygienists. It's a way of evaluating the condition of your gums. It's a great way for us to get a clear picture of the extent of your gum or periodontal disease. To measure the pocket depth, we use a special probe that has a round, thin, it's basically a round, thin, tapered ruler with a handle. Instead of inches, it's marked in little millimeters. We insert the probe into the pocket between the gum and the tooth. The instrument is smooth and the probing should be painless. The problem is, if you have got infection or inflammation, your gums are very tender and it can be a bit uncomfortable. What we do is we gently insert the ruler, the little measuring tip of the probe, until it reaches the place where the ligament of the gum attaches to the tooth, or if the ligament has been detached by disease, we contact the bone, otherwise known as the bottom of the pocket. We read the millimeter mark at the gum line, and this tells us how deep the pocket is. We continue this way, probing the pocket in up to 6 places around each tooth, recording the measurements on the periodontal or pocketing chart. Some people use an electronic chart. I have an assistant and I call out the numbers and she charts it onto your record directly. Once we have the chart, we can use that to explain it to you and show you what's going on in your mouth. We can make a copy of the chart for you so you can take it home and keep it with your records. And not only are we doing those measurements, but we're recording where there's any bleeding, which is a sign of inflammation and disease, and also measuring where there's any recession. So what do the measurements mean? Well, if the gums are healthy, a reading of 0 to 3 is considered a healthy pocket depth. But you can have the beginnings of gingivitis, which is inflammation and infection of the gums without it affecting the pockets. If the pocket depth is over 3 millimeters, you probably now not only have gingivitis, but also the beginnings of ligament damage and bone loss, which is what is called periodontitis. Once you hit the 4 millimeter mark, the chances are you have full-blown periodontitis with bone loss. These readings are a little bit like a golf score. A 2 or 3 is a lot better than a 5 or 6. And as the readings go higher, your hygiene program becomes more and more critical and takes more effort. When we finish our exam, we know everything we need to know to design and tailor-make an oral hygiene program for you and to be able to direct your energy and our energy into the right areas. If you have periodontitis, by having your pockets charted at each visit, you'll have an objective method of evaluating the progress of your hygiene program. By taking the copies of your charts home, you'll be able to look at the numbers, compare your most recent readings to previous one, and see how well you're doing, and you won't have to rely on your memory. Make a serious commitment to your oral hygiene program, and as your pocket depths decrease, you'll know your efforts are being rewarded. Also, if your bleeding scores decrease, you know that you're doing well, and that's such a good feeling. Now, these readings are invaluable to assess how far periodontitis and its associated bone loss have progressed within the pocket. And therefore, for the vast majority of patients, especially with those with periodontitis, charting the pocket depths must be included as part of your hygiene examination. I know dentists and hygienists who don't measure your pocket depth. I know because when patients come to see me, they go, I've never had this done. They have no idea what we're doing. We can't determine the pocket depth by looking at what your gums look like from the outside. Neither can they be properly evaluated with x-rays. If my dentist or my hygienist was unwilling to chart my pockets, and if they didn't have an outstanding reason for not doing so, then I would be very, very concerned. I would be looking for another person to care for my teeth and gums. Doesn't matter to me whether I've been treating you for years or not, and I don't think and you don't think there's any problems. We must measure your pockets, otherwise we don't know. We have no idea. Imagine you go to your doctor and you go, "Doctor, I'm here for a medical," and they just look you up and down and they go, "Well, you look well." You'd be a bit stressed. You go, "Well, what about doing some tests? What about checking my blood pressure? What about listening to my heart as a bare minimum?" How do they know what's going on inside if they don't test for it? It's like checking the oil in your car. You got to check it. You put your dipstick in and you measure where the oil is and you know exactly what's going on. Look, I can often get a very good feel for what's going on in your mouth. I've been doing dentistry for over 35 years, but I still get surprised and shocked when I'm doing pocket readings for people, because without doing those, I've got no true idea of what's going on underneath. It's your mouth and it's your money. We need to work together. We need to give you the best care. We need to make sure we're doing the pocket readings. We're going to use other methods to make our final examination. We'll assess what symptoms you may have described. I'm going to look at the firmness and the colour of your gum, whether there's or not there's any pain, whether there's swelling, whether there's pus discharge, whether there's mobility and bleeding. And those combined results of the findings with the periodontal chart help us determine exactly what's going on and what treatment you need and what is going to influence your hygiene program at home. So how many appointments will you need? Well, we're going to decide from the diagnosis how many therapy visits your situation requires. I'm going to have a good idea about this at your first exam. If your teeth and gums are in good shape, most hygiene therapists and most dentists will examine your mouth, clean your teeth in the same appointment, and then we'll see you in 6 months for your recare. But if you've got periodontitis with bone loss, lots of calculus or tartar, deep pockets and infections, you're going to require more appointments. That's not a maintenance clean. That is treatment of disease that you need. I speak from experience. If you've got advanced gum disease, you cannot get all your hygiene therapy done in 1 or 2 visits. It's not the best way to go. Let us be your guide. Let us do what we call root planing and curettage, which is basically going in with special tools to clean underneath the gums, polish the root surfaces. And this is going to take more time and more effort than just giving you a maintenance clean. Cleaning and polishing your enamel, it doesn't take that long. So you've got to be prepared for and willing to accept that it's going to be extra time and extra cost involved in getting your mouth healthy. If you're starting from, if I go on a short flight, it's going to be cheaper, take less time than going on a long flight. So if we imagine you've got a healthy mouth or only a mild bit of disease, it's only a short flight to get you healthy again. If you've got a lot of things going on, you're on a long haul plane. You might have to take several legs. We might have to break the journey up. It's going to cost more and it's going to take longer. It's going to take a few more trips to the dental office and it's going to take spending more money to get your mouth healthy, but it's in your best interest. In this situation, we're going to ask you to take the time between that first and second cleaning to take the opportunity to see how much healing you can do on your own. If you perform your hygiene homework, you're going to be able to see what difference your efforts make. When it comes for your second cleaning procedure, you're going to find that it's a lot less traumatic for your gums. For me, doing the work, and especially for you. At the second appointment, this is going to be the moment of truth appointment. We'll know how much of a commitment you've actually made and whether you're walking your talk. If you've had any difficulties following the hygiene instructions, or if you like talking better than doing. Usually you've had a chance to visit and ask questions. Anything that comes up since the first visit, we're going to re-examine you. We may rechart your pocket depths depending on what we need at that stage. We're going to finish cleaning any of your teeth. And I usually, if you've got periodontitis, will do a course of treatment, get everything treated, and then I will bring you back for a review about 4 weeks after. And it's at that one I like to remeasure all the pocket charts for you. Those new pocket readings were going to allow us to assess your progress. This is really important if you had pockets over 3 millimeters at your first appointment. You may not able to be, you can't see inside your own pockets, but we can definitely compare the two charts. You can call them, maps, because these charts are going to give you a wealth of information and they're going to give you the guidance that you need to save your teeth. At each subsequent appointment, we're going to continue to fine-tune your individual programs. We're going to point out any areas where you've done really well and we've got great results, and other areas that you're not doing so well or aren't responding, so we can redirect your efforts. What should you do at every hygienist appointment? Well, I would say you should write down their comments and instructions so that you remember what to do. Okay, so what happens if the results are not up to scratch? What happens if things don't go how we anticipate? Well, first of all, don't be discouraged. We're not going to judge you. We're there to help you. We're not going to be critical. We're there to make sure we're working together. We want to make sure you're putting in the effort to make the change. And the fact that you keep coming back for your appointments is a really good start. We know it takes time to go from poor or bad hygiene habits into better ones. It can take time and some effort to break them. And there could be a number of reasons why we're not seeing the results and you haven't succeeded yet. It could be that you didn't understand some of the things you were told. You maybe haven't really been doing your job the way you should have been. And I think it's really important to just admit it, and we'll get you back on track. You may be having a problem with dexterity and you find that you can't really get the brush and the floss and the things to do what they need to do. You've been a bit up and down with your hygiene routine. It's also possible that you could have some underlying health issues and illnesses that are inhibiting or reducing your body's ability to resist infection and heal properly. And this is why we take your health history, so that we understand what's going on. And, if you don't list illnesses and conditions, then we don't know that that's going on and we're missing an important link. But I don't want you to give up. Persevere. For some people, it just takes a little bit longer to turn things around. And then that's where we have to look at things like, are you clenching and grinding your teeth? Because that can actually cause gum issues to take longer to heal. Is your eating and your nutrition and your lifestyle a bit out of balance? Are your stress levels and therefore your cortisol levels too high? Are your blood sugars a little bit out of whack? Are you deficient in some minerals and nutrients? All these things can play a role in how well your gums respond to treatment. So you may require additional visits. You may find you need more than 1 or 2 visits to get your mouth on track. Remember, your efforts will succeed. Don't get discouraged. Your hygienist is going to work with you until every last pocket of resistance has been eliminated. If your hygiene therapy requires more than 3 appointments, you should have an additional follow-up and evaluation 3-4 weeks after your final appointment. And this is important, especially if this was your first hygiene therapy program in a while and you haven't yet established your home care program. It's also important if you have advanced periodontal disease. I suggest that you have this follow-up visit so we can review, we can remeasure, and we can let you know how well you're doing and just pick up on any areas that aren't quite coming under control nice and quickly. And then we can fine-tune your hygiene program. I think it's worth the time and the money to do this because the cost of you losing teeth, then having to have teeth replacements is huge. The cost to your health and well-being is also huge and sometimes irreversible. Now, I don't do periodontal surgery. It's not as common as it used to be. We work with our periodontists, and a lot more now we do laser treatments. But sometimes there are surgeries that need to be done. We like to try and only do that as a last resort. But if you do need surgery, our job is to make sure that that surgery is easier and it's going to be less extensive because you've already done a great deal of healing on your own and with us, then less surgery will be required, and hopefully we save you some expense and trauma by doing what we need to do in the chair and because you've took responsibility. We need to make sure that you've got your preventive knowledge, then that you'll use it, and that we're never going to put you back in the same place. What saddens me greatly is how many patients will come, they get the periodontal therapy done, then they don't return for their follow-ups, they don't return for their preventive and maintenance care, then they come back, 2-3 year hiatus, and their gum disease is as bad as it was or even worse than when I first met them. Then we've got to do periodontal therapy again. Then they're pissed off because they've got to pay significant sums of money to get that done. Then they're feeling despondent and woe is me. And then guess what they do? They don't come back again. And then the next time we see them, we're talking about losing teeth. It makes no sense to me to commit to a course of hygiene therapy and disease treatment if you then don't continue with prevention and maintenance. That is a disaster. If you don't change what got you in the situation in the first place, it's not going to get better. I don't want to rush you to the periodontist. I don't want to rush you into surgery. That's not my approach. We should be working with you to avoid that and only treat with surgery where it's unavoidable. So we're going to set you up a recall program. Our aim is to get you disease-free, to get disease in remission, and to keep it in remission. And the way we do that is, first of all, we do all our visits to get your gums in a state of health, and then we want to do a recall program or a recare program. And this is where you've then got to do your work in between. So we may want to see you every 3 months, every 4 months, every 6 months, and this is going to be based on several factors. The amount of gum recession and bone loss. If you have pockets over 3 millimeters and a lot of bone loss, you're going to have to work harder to keep your mouth healthy, and you're going to find it more difficult to do so. So we'll need more frequent recall. You need to take our advice on this, and this means that, even if it means 5 or 6 or 4 hygiene appointments a year, if you're dedicated to having a healthy mouth and a healthy overall life, then please take that advice and attend those appointments. And then there's what you eat. Yep, we got to address your diet. You've got to do your home care program. You've got to look after the way that you eat, and you're going to need fewer cleanings if you eat more raw, natural foods and avoid processed rubbish. You're going to need more cleanings if your diet mainly consists of refined, soft, processed and overcooked foods, because they're the things that are feeding the bacteria that are causing the problems. And then your overall attitude. If your willingness to stay involved in your program, then we're going to look after you. The more you do, the less I've got to do, the less the hygienist has to do, and the longer you can go between your recall appointments. In addition, we're going to take into account an evaluation of you and your lifestyle, your personality type, your profession, your age, health history, habits such as smoking, drinking, grinding and clenching your teeth. And these are all factored into how we decide how often we need to see you. We want to make sure we help you have the best health. Don't hide things from us, because if we don't work together and you don't communicate with us, we can't figure out what's going on, and we can't then prescribe the best way to take care of you. So further down the road, that recall is a living and breathing thing, and it will change. So sometimes I'm going to say, hey, things are looking great, let's see you in 6 months. And we continue with that. And then we hit a point where I go, hang on, things are not looking so great. We need to do some more therapy, or I need to see you more regularly. And this could be because there's changes in your health, your age, changes in your hormones, changes in your lifestyle, changes in your oral hygiene practice. Got a bit slack, and we've got to get things back on track again. So we need to be fluid with that. Don't get locked into, but you told me every 6 months. If things are looking good, we'll keep you on the same schedule. If things need attention, we're going to change the schedule. If you're doing really well, then you can go longer between cleanings. If things are really great, then this is fantastic. I don't need to see you so often. If you're concerned, I have patients who are like, no, I want to stay on my 3-month recall. And that's great. But what we've got to do is work together. You've got to do your home care. I'm not coming in for you at night and brushing and flossing your teeth for you. This is for you to do it. No one is there ringing you up and reminding you or texting you and saying, hey, you got to brush after meals. Did you brush before you go to bed? Remember, feel good about what you're achieving, and don't forget to thank your hygienist or your dentist for their support. Now, there's another reason for regular recalls. Eventually, you could go a year or more before you really need a cleaning. This will be up to you. But even after you've won your war against gum disease and tooth decay, there's other reasons why we need to see you regularly for your checkups. And that is something that's not commonly known. Every 6 months, you should get what we call an oral cancer check, or a soft tissue examination, both inside the mouth and in the head and neck area. This visit is really crucial if you don't regularly examine these areas yourself, or if you or anyone else in your family has a history of these type of diseases. As you've discovered, there are diseases other than tooth decay and gum disease that show up in your mouth. And the few dollars and the few minutes it takes to have a look around and check things out really does give you peace of mind. It's possible that your hygienist or your dentist may not feel comfortable about doing a head and neck exam. And if that's the case, then make sure you ask at your next checkup. The cost of your hygiene therapy depends on the condition of your teeth and gums, who performs the therapy, and in where you live. There's different costs and different fees for different dental practices. The hygienist or the dentist will do what they need to do. If we need to do more than a basic clean and maintenance, then the costs will go up. But regardless of the cost, an ounce of prevention always goes a really long way. It is cheaper to have preventive care than it is to rectify and remediate issues. Well, I want to say thank you. I want to say thank you very much for joining me today. I'm Dr. Rachel Hall. This is The Dental Zone. I want to say thank you for listening to the podcast, for supporting the show. I want to thank you for being interested enough to listen to me talking and to take the time to care for your mouth, teeth and gums, to learn what you can do better and what you can do differently to have a healthy mouth and a healthy life. Thank you so much for joining me. I'm Dr. Rachel Hall, holistic dentist. If you'd like to know more, hop on over to holisticdentistry.au or evolvedental.com.au. And if you'd like to book in for a consultation, then email info@evolvedental.com.au or pick up the phone, because we really do like talking to human beings, 0737201811. And for now, stay in the zone. You've been listening to the Dental Zone podcast with Dr. Rachel Hall. For health, lifestyle, fitness, and a great smile, get in the zone.